Hi, my name is Dominic Hussey. I'm a functional medicine practitioner and osteopath working in Ottawa at Complete Wellbeing. Today, I would like to discuss how starting with gut health is the best treatment for autism in children. Let's jump in and start with what I consider are the achievable goals when treating children with autism. My pediatric functional medicine approach to the achievable goals of treating autism includes the following. Don't treat autism, I treat the child. Never look to cure children of autism. I first look at optimizing gut health. Let's examine why gut health is important when treating children with autism. Researchers are finding more and more the link between gut health and autism. For example, a conclusion from a 2014 paper said, emerging evidence for gut-brain connection in autism, wherein GI function may contribute to the pathogenesis or severity of autism symptoms. Typical gut symptoms I observe in autistic children include bloating, constipation, diarrhea, and gas. Clinical signs of poor gut health include dysbiosis, an imbalance of bacteria, fungi, and parasites, bacterial and fungal overgrowth, SIBO and SIFO, and intestinal permeability, leaky gut. Let's now look at the consequences of poor gut health. Poor gut health can lead to the following. Poor neurotransmitter function. Neurotransmitters control gut motility, bile, and enzyme secretion. Inadequate secretions can lead to poor absorption of nutrients. Neuroinflammation. Inflammation in the gut can lead to inflammation in the nervous system, especially if there is a leaky gut. Neuroinflammation can lead to anxiety and behavioral issues such as aggression. And thirdly, imbalance in the gut microbiota. This can lead also to anxiety and behavioral issues. Let's now look at how I assess gut health. There are three primary resources I use to assess gut health in children with autism. Firstly, a comprehensive case history, gathering information about current symptoms, past medical history, family history, diet, and lifestyle all help me understand the current state of the child's gut health. Secondly, muscle response testing. Muscle testing is beneficial. I use it to help confirm the conclusions from the case history. And thirdly, PCR stool testing. PCR stool testing, such as GI map test, shows me the composition of a child's microbiota, including bacteria, parasites, fungi, and viruses. In addition, it looks at secretion function and inflammatory and leaky gut markers. Let's now look at the typical stool test findings in autistic children. The following are the typical GI map stool test results I find in autistic children. Firstly, overgrowth of gut pathogens. Secondly, overgrowth of normal bacteria. Thirdly, high beneficial bacteria. Fourthly, poor digestive function. Fifth, gluten sensitivity. Sixth, inflammation. and seventh, intestinal hyperpermeability or leaky gut. Let's now look at how these imbalances in gut health can affect symptoms in autistic children. The GI map test may show the following: overgrowth of a gut pathogen such as C. difficile can lead to a build-up of the neurotransmitter dopamine, which can cause behavioural issues. An overgrowth of E. coli can affect serotonin uptake, which can cause issues in children with autism. Overgrowth of friendly beneficial bacteria, such as Clostridia, can lead to anxiety, impulse control in children with autism. The overgrowth of opportunist bacteria can cause anxiety and behavioural issues. The overgrowth of opportunistic bacteria commonly triggers anxiety and mood issues. Candida overgrowth can promote histamine. Let's now look at how poor digestive function affects children with autism. The GI map test may show the following: high fat levels in the stool may mean poor fat digestion. Autistic children are often low in omega-3 fatty acids. Secondly, low levels of enzymes, which will mean poor digestion and poor absorption of nutrients. And thirdly, high levels of B-glucuronidase may indicate poor liver function and detoxification. Finally, let's examine how inflammation and leaky gut can affect children with autism. As I said, gut inflammation can lead to neuroinflammation and behavioural issues, especially aggression. The signs of inflammation on a GI map stool test include the following: high or low secretory IgA, a sign of food sensitivities; high anti-gliadin antigens, i.e. gluten sensitivity; high calprotectin, a sign of inflammation and possibly inflammatory bowel disease; and high zonulin, a leaky gut. Let's now look at how I treat the gut. The following is a summary of how I treat the gut in children with autism. Firstly, removal of inflammatory foods, including food sensitivities, FODMAPs, and sugar. Secondly, treat any dysbiosis using probiotics and antimicrobial herbs. Heal a leaky gut by lowering inflammation and using probiotics and healing supplements like glutamine. Treating children with autism can be challenging. Let's now look at the unique challenges I see when treating children with autism. When treating children with autism, I face some unique challenges, including communication of symptoms. The child may be unable to express their concerns. Physical exam. The child may not want me to touch them. Specimen collection. If I recommend a blood or stool test, the sample collection may be difficult for the child. Dietary changes. If I recommend dietary changes, these may be difficult for the child. And texture and flavour of supplements. As you can see, there are various unique challenges to treating children with autism, which often require practical solutions. Finally, let's look at what other factors I look at when treating children with autism. The other factors I consider including the following. Firstly, structural issues. especially cranial dysfunctions. Nutritional deficiencies including omega-3 and vitamin D. Current stress, is the child unhappy with anything in their everyday life? Past emotional traumas, past physical traumas including during birth, operations, vaccinations and concussions. And finally, environmental toxins including heavy metals, mold and glyphosate. Thanks very much for listening, and if you want to find out more about my practice, you can click on the link below.